Next up, we have Scott Noble. So Scott, go ahead.
He's unmuted.
Thank you everyone for joining. My name is Scott Noble, and I'm here to talk about what do providers and researchers think about interventions. Before I get started, let me give you a little background about myself. I grew up on the south side of Chicago, one of two siblings. My mother was a school teacher for a number of years. My father was in and out of the household. There was no physical abuse, but because of my father's alcoholism, he was verbally abusive to me. At the age of 16, I left home. I'm going to say my mental illness started to really surface at the age of 18 when I tried to commit suicide. I was admitted to Rush Presbyterian St. Luke Hospital, where at that age, the doctor interviewed me and just said that I was just young and that the mental illness would pass. So at that point, by me not being treated, I started to self-medicate, which landed me in the House of Corrections as a guest for a number of years. And not at that point not trying to commit suicide, but really feeling helpless, hopeless. And then at one point when I found out the stigma, I really tried to hide it. What I'm doing now, I've been on several IIT advisory boards. I've led one research team that researched the barriers of healthcare access experienced by male sex workers. At the age of 50, I was hired at Advanced Ministries for community engagement specialist. And currently through this CBR project and my years of experience, I have created my own organization called Unity Network Community, and I'm definitely using the CBPR manual as a guideline and tool. Now, getting into what we're talking about, next slide, I'm sorry. Okay. Now, I'm sure we know there are many programs and interventions to help returning citizens with mental illness. At the time when I was getting incarcerated and before I was diagnosed, I knew of Gateway and Reed. Providers know how interventions work from their experience, and researchers are more familiar with their research evidence. And that's usually used by focus group surveys and data collection. Now, what we wanted to see were which interventions our expert panel members were familiar with and which they thought might work best to help African Americans with mental illness. Now, these are the methods that we use. We ask providers and researchers to tell us about programs or interventions that can help returning citizens with mental illness. We made a list of all the interventions, which was a total of 45. Now, step 3 was we asked providers and researchers to tell us how familiar they were with each one and how helpful they thought it was. Now, the questions that we came up with were, how likely will the following services or interventions improve the health with people with serious mental illness who are transitioning from incarceration? 10 more likely to improve health. And how familiar are you with each of the intervention till 10 most familiar? Now, these were the results that we came up with. There is definitely a distinguish between how familiar and which ones you think are effective. First was trauma-informed. First one, how familiar are providers with interventions? How familiar? Out of 29 providers, we got the 10 top most answers. One is trauma-informed care, which is basically means that a provider has to assume that more likely than unlikely that you have faced trauma. That's why a lot of times you go to the doctor warns you if he's going to reach you in a certain area or touch you in a certain area. Motivational interviewing, psychotherapy counseling, and harm reduction were the top ones. Now, how effective, which is totally a different thing. Being familiar and effective are two different things. How effective do providers think these interventions are? Number one, again, is trauma-informed care. Definitely supportive housing. That was a big help for me because if I got off the streets, felt like I was able to regroup or to figure out what the plan was, or to just to face my demons. We asked 29 providers, and these were the 10 most effective that they thought were effective. Okay. The next one was, how familiar are researchers with interventions? We asked 10 researchers, we got the 10 top answers. Problem-solving courts, such as probably treatment, mandated to drug treatment, house arrest, mandatory supervised release, jail diversion. Now, the next one was, how effective do researchers think interventions are? We asked 10 researchers, and these were the 10 top answers. Number one is integrated care, which was very helpful to me, having multiple issues. Along with the mental illness, which was really on the back burner, I had a substance abuse problem. I had to end up going to chemotherapy. I was having problems with my kidneys, so it was really helpful to have integrated care, one-stop shop. That's what I call it. Okay. Now, looking at all the results that we got, like I said, familiarity and effective are two different things. Now, these are the answers that providers and researchers came up with that were identical. Motivational interviewing, psychotherapy counseling, harm reduction, which was helpful for me because I had so many things on my plate. It was just overwhelming to just stop and treat everything at once. And cognitive behavior. Those were the top ones that providers and researchers were familiar with. But then if you look, there are some things that are not, they didn't agree upon, like providers, intense case management. And then the researchers felt that medication-assisted treatment was they were more familiar with. Okay, we're still talking about effectiveness, provider and researcher. These are the top answers that both agreed upon: integrated care, supportive housing, housing first, medication management and monitoring, which was really helpful to me because I had so many things going on. I had multiple medications. And for me, it was easier to try to pick which medication I needed for which I thought, which illness I had was more serious, but you have to treat them all. Harm reduction. These are both what the researcher and the provider found effective. Now, after gathering all this information, what does this mean? Providers and researchers prioritize some of the same interventions as you saw, but also have some differences. Providers in our study were more familiar with individual health-related treatment, and researchers knew more about transitional practice and interventions. People providing service in the community may not be aware of the transitional interventions or evidence for them specific to returned citizens. Now, the next steps. We need to find out which interventions are preferred by people with lived experience. See which interventions work best for returning citizens who are African Americans and have a mental illness. Some interventions might be more difficult to implement than others, and that can basically be based on funding. A lot of people, they get out of jail, they don't have anywhere to go to keep up with them, and getting support for all these things. I just wanted to say after all of this that mental illness really does carry a stigma, and that's something that we really do have to try to alleviate. And this is just something I just looked up. I was curious. 1 in 4 people will be affected by mental illness or neurological disorders at some point in their lives. There are about 450 million people currently suffering from such conditions. And I'm not sure which ones, how many of them of them are getting treated and not treated. So that's it. Any questions?